So when we're dealing with a clitoris that is too large, patients oftentimes ask me, can't we just lift up the clitoris tissue and tuck it in there and get a nice result? And they'll often be able to kind of simulate this when we visit in the office and say, can't we just push it back in? And there's a few reasons why this isn't the case. Hello, my name is Dr. Sight Gallagher. I'm a board certified plastic and reconstructive surgeon with a special interest in genital plastic surgery. So, clitoromegaly is a term used to describe a clitoris that's too big. Now, too big, it really depends on the patient's own perception more than anything. And so to diagnose clitoromegaly, we usually talk about the glans or the tip of the clitoris being more than 0.5 centimeter or 5 millimeters, and the length of the clitoris being more than about 1 centimeter. Obviously, this varies a lot depending on the anatomy that's around a patient. So, for example, in a very slim patient, you'll be able to see a lot more of the clitoris than in a patient who has more weight down there because it's more buried. Oftentimes patients are misdiagnosed and get what's called a clitoral hood reduction, where that is just for when there's extra skin around the clitoris itself and not a clitoral reduction. And unfortunately, this can make the problem worse. Typically, patients who complain of clitoromegaly, their main complaint is when they look down, they see a penis. Or when they get aroused, oftentimes the clitoris will double in size and then it seems to stick out and they're very self-conscious about it. In order to treat this problem, what we do is we go in very carefully under magnification. We remove the head of the clitoris and the nerves and arteries off the erectile tissue below and trim it back, and then rearrange everything, make it look as pretty as possible. Typically we're doing a labiaplasty with this, and also by definition a clitoral hood reduction as well, to lift everything up and tuck it in. So the reason you can't just come along and tuck everything in is because of that erectile tissue. Because like I said, when a patient gets aroused in particular, it's going to swell up, and therefore it is even theoretically possible, if you try to stuff it back in there, to cause pain with doing that. And again, you're still going to see the protrusion of the clitoris itself. So really what most patients with a clitoris that's too big, usually what they need is a reduction of that erectile tissue. Overall, what we're working on, our surgical field, things are very small. So usually I'm reducing down the glans at the end of the procedure as well, and removing that erectile tissue. But typically it's just a centimeter or two of erectile tissue, depending on the individual patient. I hope this helps explain it. This is a procedure that's really poorly understood, and unfortunately it's not available a lot because the clitoris is a super important, a super sensory organ. We need to be extremely careful with it, and therefore not many plastic surgeons are willing to go there. They do labiaplasty, which deals with the tissue around it, but in some patients that's just not going to work, and in order to meet their needs and their goals, we need a clitoral reduction instead. This surgery takes me about 2.5 hours to do. You go to sleep for it. Recovery is usually 1 to 2 weeks off work, depending on your swelling, about 4 weeks before working out again, and on average 4 to 6 weeks before sex again. I hope this helps. We're accepting consults for this. Reach out in the links below. Thank you.